Hello everyone, Professor Miller, and today we are going to talk about ultrasound. So as you were looking at these photos, what does a battleship, a bat, and a dolphin have in common? Go ahead, take a few minutes and write down what it is that these three objects have in common. So, what is it that the bat, the dolphin, and the battleship have in common? They use sonar, which is a form of ultrasound, to detect objects in the water. It is how they see if their eyesight is not well developed, which is the case of bats. A battleship uses sonar to find objects in the water, submarines, things that they could potentially run into, such as icebergs, that they will not be damaged. Ultrasound is the process of the transmission of sound waves to detect the size and shape of an organ or the direction of blood flow. The sound waves are at a frequency or a pitch that we as humans cannot hear. Animals use ultrasound to find their way or their dinner. Dolphins will use sonar to find their way through the water. Bats will use sonar as well to go ahead and find dinner so they don't run into objects because their eyesight is not well developed. In medicine, we use ultrasound to assess for diseases. We can look for decreasing blood flow in blood vessels. We often use it to determine fetal size and determine the sex in unborn children. We can assess the gallbladder and look for gallstones. Looking at the heart, we can look at blood flow as well as the size of the heart. We can get dimensions. And so it is very valuable, the amount of information that we can get without invading the patient's body. It is what we consider a non-invasive diagnostic test. What you see here is an ultrasound of a patient's blood vessels. The red indicates an artery, the blue indicates a vein. And as you see across the bottom here, that is indicating a pulse. And you can hear the swishing of the blood and the pulse together. This shows a picture of an occluded artery. And as you see, the blood flow is stopped. So you see the oxygenated blood is not continuing up to a structure or an organ, nor is there a return blood flow because this whole area in here is occluded. What might be some of the things that can cause an occlusion? Well, we can see plaque, which is from all those fatty foods that we eat, cause plaque, fat, to build up inside our arteries. We can have a spasm, which closes the artery, or we can have a tumor that may be compressing down on the vessel itself. When we use ultrasound to assess a patient's heart, we call that an echocardiogram. As you can see here, it shows us the blood flow through the heart itself. So we want to make sure that the flow is in the proper direction and that we do not see any mixing of the blood. So red meaning oxygenated, that is the left side of our heart, and right being without oxygen, and that is on the right side of the heart. The right side of the heart sends the blood out to the lungs so it can come back to the left side of the heart with oxygen. This is Susie in a pregnant state. So when we're looking at ultrasound, we are going to be putting sound waves into mom's abdomen to check baby's structures. So what we're going to do is, you can see I have already put some gel on her abdomen, and we're going to take this sensor and we're going to just move it around her abdomen as we are looking for various structures of the baby. And so we'll do this. We'll also do this if we are looking at the gallbladder up here, or if our patient had an abnormal x-ray. Maybe we're going to be doing it on the lady's breast tissue because we found a lump there. So those are some ways that we can use ultrasound to go ahead and look at how structures are formed and making sure we have adequate blood flow through blood vessels as well. And that wraps up ultrasound. If you have any questions, please email Mr. Dorsey and he will forward them to me, and I will get back to you with an answer. Thank you and have a good day.